A 55 years old man present with a soft fluctuant lesion overlying his right scapula. The surgeon suspects the lesion may be lipoma. Which of the following, if present, may be indicative of alternative diagnosis? So, a 55 years old man present with the lesion or tumor in the scapula, which is soft and fluctuant, and the surgeon suspect it is the lipoma. But what may be the other diagnosis? And if we want to do other diagnosis, what is the criteria? Here are the options. Options are located in superficial tissue, size greater than 5 centimeter, presence of multiple similar lesion other anatomical sites, increased mobility of the lesion, lobulated appearance during the surgical excisions. So first of all, let's see the lipomata or lipoma. The lipomata or lipoma, it is the benign tumor arising from the adipocyte or fat cell. So from the fat cell or from the adipocyte, if any tumor develop, this is known as the lipoma, and occurs in middle of the age adult, and it is smooth, it is mobile and user dependent. And the subtypes angiolipoma, lipomyoma, and malignant transformation is rare, but there is suspicion of the malignancy if there is certain clinical feature. So feature suggestive of the sarcomata sense, of the lipoma. First of all, the size. When the size is greater than 5 centimeter, so when the size is more than 5 centimeter, we should suspect a case of this sarcomata. Also increasing size, that means a lipoma present longer period of the time, 3 year, 4 year, 5 year, but suddenly the size is increasing, so it is another suspicion. And pain, suddenly there is the development of the pain in this condition, it also, and sometimes maybe bleeding. So pain, bleeding, discharge from the wound, from the lump, it usually indicates it may be sarcomatosis. And also the deep anatomical position. So deep anatomical location or deep anatomical location of the lipoma, it is suggestive of sarcomatosis. So the lipomata removed surgically, benign lesion are often small and well encapsulated. Deep-seated or lesion larger than 5 centimeter are increased risk of being associated with sarcomatosis. Lipomas are typically a small and mobile lesion. So when it is become fixed from the mobile position, it also the another suspicion for sarcomatosis. And they may be multiple lesion more than 5 centimeter may indicative of soft tissue sarcoma, which is malignancy. Additional diagnostic test may be required prior to the excision. So sometimes before the excision, we can do the FNAC or truncated biopsy for the diagnosis. So which is the indicative of alternative diagnosis? That means it is the surgeon suspect it is lipoma, but it may be liposarcoma. So what is the feature? This feature when it is greater than 5 centimeter. Other options here we can see it located in the superficial tissue, not that. When it is located in the deeper structure, then it should suspect for liposarcoma. Presence of multiple similar lesion in the another anatomical location. It is not true. Multiple site may be present. Increased mobility of the lesion, actually for sarcomatosis it is the fixity, and lobular appearance during the surgical excision, it is also not true. So only the true option regarding the sarcomatosis is the size greater than 5 centimeter.